Well, thank you. The National Institute for African American Health sort of grew out of the lack of African American physicians. One of the reasons why, physicians you don't have to be culturally competent as far as African Americans, if you are one. If you grew up in the same neighborhood and the supermarket doesn't have this or that, and you have there's less cultural competence for your same race that you need to have. So if we could increase the number of African American physicians and providers, then they're more available to treat that population. Right now, there's 4 to 5% of physicians are African American compared to 13% population. So that's a significant disparity, and African Americans disproportionately treat African Americans. So if you're African American, your odds are you're going to end up treating, like me, a disproportionate number of African Americans, probably whatever that number is based on your specialty. And so knowing that we have this deficiency in African American patients, and knowing that we really need to increase that number, but we didn't have a way to support them. And so, I found when I went to medical school, I got a lot of support from a majority of students, as I made friends, that they would share study tips and study tools and whatnot. But I was sort of at a disadvantage because I didn't have the help, and maybe who knows, maybe their parents shared with them, their parents were doctors, they shared with them information that helped them get off to a strong start. And so people, and practicing for standardized tests, you have to practice that, I did at least, in order to become successful. And so if you don't know, you need to practice these tests. You need to do a ton of questions, and you need to shoot for a certain percentage before you sit down for the MCAT. You don't sit down with the MCAT and hope for a good score. And there's so many students that do that. If you don't have someone say, no, that's a terrible plan, right? So the Institute is going to be a sort of an online thing that we're going to connect African American providers with African American pre-med students and then med students, and just sort of give them sort of a built-in mentor that can kind of help them with the interview, help them answer questions about their record, just sort of help them in a way that they may not have access. If you're the first doctor in your family, you can't find out how to respond on a rotation, or what to do in an interview, or to have a mock interview, right? And so we'll be available to support them through that. We'll also have an online resource for African Americans, so they can have an online trusted resource to go to and get good information about their health. And so we're going to have a website, NIAAH.org, that people can go to. They'll say, what about the CDC? Well, that 44% of African Americans who don't trust providers don't trust the CDC. They don't trust the NIH. Don't ask me why. I trust the CDC and the NIH, but they don't. So they're not going to go to the county board of health, even though I'm the chairman. They're not going to go there and seek trusted information. So we're going to try to build a website that will be trusted, that will be driven by people that they know and people that look like them, and give them, again, specific information on why smoking is particularly bad in African Americans, why taking your medicine is good, why getting a colonoscopy at 45, not 50 is beneficial, why you need to go have your post-op chemotherapy. What people don't understand, what is that? I had the surgery. You said you got it all. Why do I have to take this? Explain that specifically for African Americans as a way to help support them. So we've got high dreams and not enough hours in the day, but we're looking forward to making a positive contribution with the National Institute on African American Health.